Hey everyone, it's Dr. Hartung here. I want to talk to you about the stages of care or the phases of care. We talk about this a lot throughout your treatment plan, but I thought I'd demonstrate it here a little bit here. What are the phases of care? What are the difference? And what happens if you don't do them? So first of all, my red light here represents oftentimes when we meet you, meaning that you're having some pain. The light's on, your body's at the point where something's wrong enough that you're in pain. So this is you moving along the phase. We meet here. We're having a problem enough that you're in pain. We usually start treatment and you're in the first phase of care, which would be pain phase. Obvious, right? So as we start to do some treatment, those first couple of weeks often, we'll get enough movement away from the problem that the pain goes away because we've moved the pressure away from what was causing the pain. So that's pain relief, and it's usually pretty brief. It differs from other forms of care because it's usually frequent, and oftentimes the therapies and things that we might be doing at home might be different than other types of care. Now, if a patient stops here, which can be tempting because you're feeling good, so why would we continue? The problem becomes is that you're living very close to that pain coming back. Meaning that any little twist or tweak or problem, boom, and the pain's back on again. And we're back in trouble again. So what happens if we continue through to the next phase of care? So we got past our pain phase and we are in the next phase, which would be correction. Correction phase is when we've moved that problem far enough, we've improved it, that you're not in active pain anymore. But as I mentioned, you're very close to it. You're still kind of in the danger zone here. We're going to work really hard to try to sprint through this phase where we're correcting the alignment, correcting the underlying issues up to the best possible capacity, the best alignment, the best movement, so we're gain margin away from this. So that we don't have so easily, if you have one restless night of sleep or one misstep, it doesn't jump back and turn that light back on again. So that's corrective phase, and it gets you correction, just like it sounds like. Now, the next phase of care would be the stabilizing phase of care. And how does this differ from the other phases? So pain relief and correction often are very similar. The frequency is increased because we're making a big difference to the underlying structure. Oftentimes, the home care or the in-office supportive care may be different as well. This is often the multiple times, sometimes daily care while we're in pain, or at least 3 times a week care. Once we get to the stabilizing phase, often our frequency of care can reduce. This will often be a twice a week phase of care. We're out of pain for the most part, and our goals change. When we're treating you now, we're getting the best alignments, we're getting the best movements, but your body hasn't accepted that as normal yet. So if we let go of it here, if someone stops care at the end of correction and doesn't stabilize, it's very little time before their body lets them slide back again and they're in pain again because there was no stability. Your muscles hadn't gotten used to that proper alignment yet. So once we've gotten the correction, we need to move through the stabilizing phase of care in order to make sure that this is a lasting fix. So once again, we move through that next phase, usually twice a week, and often doing similar adjustments and some supportive things through the office until we get you to a level where you are stabilized. What that means is your body has started to accept that normal alignment. You're not so dangerous because it's much less likely that you're going to slide back. You have more durability. You're able to do all of your normal activities. You're able to have a misstep or a bad lift or a bad night of sleep or a hard week of work, and your body has enough durability that it doesn't immediately slip back to where it started. At this phase, this is when we'll usually graduate you out of what we might call our active treatment phase. We've corrected the problem, we've gotten you out of pain, we've stabilized the condition. At that point, you'll have a decision to make. The next phase of care would be wellness or supportive care. And this is a decision that is important. Some folks will decide to discontinue care as soon as they're stabilized for their primary condition. And so gradually, in the coming months and years, the daily wear and tear of life is pulling you back into this uncorrected phase until eventually, months or a few years down the road, bam, you're back in pain, and we start that whole process over again. So what we try to encourage our patients to do is, once we've gone through pain relief, correction, and stabilized it, to adopt some level of wellness or supportive care. Wellness care is aimed at identifying some of those little tweaks that are going to try to build up on you on some regular but often very infrequent basis, and getting an occasional checkup or an occasional adjustment in the office to stay ahead of those things before they cause pain. We don't want to only see you when you're here and you're in a mess. We want to make sure that you stay here. So as we moved into the wellness or supportive phase of care, you're going to live in this green section, which means we adjust you up to your best capacity. You go through the next several weeks or month of life, exercise and work and family and all of those things, and your body starts to slide back a little bit, but then you're due for your next wellness adjustment, and boom, we pop you back right up here again. And you live right there back and forth, not letting it ever get back down into this other phase. Wellness care differs from these other phases because, once again, it's usually much, much less frequent care. Often it does not require a lot of support, and it's very quick and easy, and the dividends that are paid, they make a huge difference not only in your symptoms day to day, but also in the general mobility and health going forward. So those are the few phases of care that you could be in if you're in our office. If you have a question about where you are and what that means, then ask your treating doctor.